promising field that a hospital can get into. Worldwide, there is a $60 billion market, as I understand from statistics, and India's share in that is about 4%. 4 billion. So we are not one of the major, player in globally. Despite the fact, which is something which is interesting, and that's where I will like to start off with. Despite the fact that we are considered to be a low-cost healthcare model, and which probably is going to go down further, if things shape up the way that we discussed in the morning. So, despite the fact, why India is not considered to be a destination place for medical tourism. So that is where I would like to start with. Let me begin with Dr. Padmakumar, who has worked in the Middle East, from where probably there is a lot of inflow of patients, especially to this state. And what is your opinion, sir? That why are we lacking behind?
Indian total perspective, as he said, maybe only 4%. Mainly because India, if it is like other destinations, if you see, people go to Thailand, Singapore, all those smaller places where it's like a compact kind of a setting with the government and other agencies, everything. India being so wide and different cultures, all this, people look at us Chennai, Mumbai, Delhi, Cochin or Kerala like that. It's not less a common place or a destination of identity has not been actually coming, because it's like different cities far apart. And the governmental supports are also not there to promote medical tourism to that extent, and maybe because of the diversity and the larger area, we were not able to group it and project India as a medical tourism destination. Maybe there should be some effort to see that all these are combined together and projected world across. Otherwise, as you said, cost is definitely lesser in Indian scenario. But the conveniences, the comforts they get if they approach another country of a smaller nature like Thailand, all those with other promotions which are happening, it's not there yet in India. So they have their own restrictions, reservations when it is told about India. They go to a particular hospital or a particular area where there are multiple hospitals which are accredited or which are known with their medical specialty.
That's so does accreditation play a role in attracting? Is that
means
right?
At least by which they have come to know that this place is good with facilities and doctors.
So what accreditation should one aim for?
No, at least this NABH accreditations or JCA, whatever, which is known, means they expect.
So having either is okay, or JCI makes
more
business sense? Nothing like that?
No, not like
so
that.
people
Means,
know.
By JCA or even NABH, what I would actually expect is some kind of a good standard care. That's what they're expecting, the cleanliness, the kind of staff behavior, all those. That if they actually get once or something, they at least have a word of mouth publicity which is going. That is now concentrated on to only few metro cities. That's why though we are telling India has a larger space also, we are not able to make much into that medical tourism impact.
So you worked in the Middle East, but you still don't see that many faces in Kerala, where there is so much of your own diaspora. Why is that?
Yeah, now insurance is actually becoming a major factor by which patients can stay back. If you see for modern medical tourism, people, almost like 25% of them are from Gulf countries, not from other nations. All these Gulf countries are now insisting on insurance for almost all the people. Then we should concentrate on something which.
So does their insurance allow them to seek healthcare outside of Middle East?
Not majority of the companies. That is where we actually have to have some tie-up with these groups, because some of the companies are suggesting even to the patient, if you get treatment in India or where the cost is maybe half or one-fourth, some of the procedures, if they are actually choosing to come to Kerala, they encourage. That has to be actually happening from the hospital group with the insurance company, so that they have direct link and they are brought here. And we should have procedures which are not insurance covered. Like what I do is like bariatric surgery. Majority of the countries, unless the body mass index is like 50, that means almost like double the format of weight, then only they actually approve insurance. So they come down for that. or a procedure which is not done in that part of the country. Like we do keyhole thyroid surgeries, which are not popular at all in that part of the world. So they come down for a quality on a specific note. So something that is not, even maybe transplant surgeries are something which hospitals can look at, because that is not very regularly done because of the lack of expertise or something. Something which is not done there, not covered by insurance, if you focus, then I think there will be some more of a flow of patients coming this side.
Okay. Joy, I think you're clearly making some points there. But you come from Hinduja Hospital, which is probably one of the best institutions in the country. But correct me if I'm wrong. But Hinduja has never focused on medical tourism, as thing. Why is that? Why do you think that you won't want to focus on the medical tourism? Also, please tell us that like he said, that what is it that India lacks as compared to other countries which are able to attract, like say Bangkok in Thailand, Hospital or Singapore, has done much better than what India has.
So first I want to tell that I agree with your statement that Hinduja Hospital is one of the best institutions, so there is no correction. Then I take the second question first, that why India is lacking, and then I come to Hinduja Hospital specifically. Just to add few points, and as you also started in the note, that low cost healthcare, what India, or rather all of us are making a mistake. Always we try to project ourselves as a low cost healthcare. Why you need to do that? Because when you are trying to attract, automatically you are getting positioned in the mind of your clientele base. That means something is poor, so they are giving something at a lower price. So you improve your product, charge them premium, and see what happens.
Alright, you are trying to say that the marketing positioning itself is wrong, that we are the cheapest.
We are not doing the things correctly, because we are, by positioning itself, we are looking for a little bit of one particular segment whom we are trying to attract here. The second thing is.
So can I just put this to vote? Do we agree with him? I think he's made a very different point. So do you agree that we should probably not take the marketing pitch as we are cheaper?
Like we are the 1/10 of cost and all.
How many would agree with that?
So can I just jump into this conversation?
So the second thing, as you were talking about, that we need to do, probably some of the success stories, whether it is in Singapore or it is in Thailand, the country itself has promoted their healthcare tourism. It is not the individual hospital. Kerala took a lot of initiatives few years back when they are promoting the Kerala healthcare tourism. But if you think about the rest of the country, I don't think that platform has been created. Today, every hospital they go and try to position, and sorry to say, at certain point of time, one provider they try to position the other provider below their rank. So as a result of that, lot of questions and confusions and doubts are there.
Are you trying to say that there is a negative marketing between?
Not negative. Basically, they try to say, I am the best. So when that happens, it doesn't get promoted as an Indian healthcare. It is like a particular chain of hospital or individual hospital. So the way Singapore Tourism Board came up in 2004, they started promoting all their hospitals. So any patient who is coming, they need to go through their portal. They get all updated information through that portal. So there was a regulatory framework, there was a system in place by which the overall system framework was created, which is lagging in a big way here.
So do they also say that suppose you do a procedure in hospital A in Singapore or B in Singapore, from a government angle when they go marketing, would that procedure be same cost?
No, not necessarily. Okay. You tell that I am going to charge this much, so and so is going to charge, then patient has a choice where to go. Okay. And ultimately, that board they come to know what kind of practices are happening with the international patients who are visiting their country. Okay. The third, with which I'll hand over to Harish, that is, the kind of infrastructure and facility. We are talking about getting patients from Africa, maybe certain parts of Middle East, that is okay. But infrastructure-wise, how far we are compatible with some of the international level hospital organizations where so-called high-end patients are visiting. You think about Cleveland Clinic, Johns Hopkins, they have such a huge facility and the kind of infrastructure they have created to meet everybody's requirement is phenomenal. Can you imagine that 84 different language interpreters have been kept in Cleveland Clinic? They have created, when I was visiting, I was taken to a big restroom. I didn't see initially, but that person told, you know what it is. So they have written outside, family restroom. You know what is family restroom? Today we have gents and ladies. But if there is a husband, wife, one of them is patient, the other person need to help, then where they will go? Because other person will not be allowed to go to the other toilet. So they have created in such a big way. So that is the kind of understanding they have about the market requirement. And that exactly needs to be taken if you are really thinking of getting that segment of premier medical tourists to come to India.
But just a quick question out of that. Do you believe that the infrastructure of hospitals like yourselves or Aster or Lakeshore or Fortis or Apollo, are we in some way inferior to the global standards yet, or we are there?
With due respect, I don't want to take, probably some of the hospitals are okay, but that may not reach to double digit in this country. But if you really want to compete with them, if you really want to get the sheikhs of Middle East to your hospital, the infrastructure what you need to have, it is not there.
So is that a hospitality infrastructure or it is the therapeutic?
No, it is infrastructure, your building infrastructure, and plus of course hospitality, but hospitality still you can bring in. But infrastructure, when you create, probably it takes time for you to modify and meet their requirements.
So Harish, I think you have heard, coming from both of them, and I think you are a player who has fairly, impressive footprint both in India and in the Middle East. But how is, have you been able to, leverage that, and have you been able to get some medical tourism traffic into India?
So, before I answer your question, I want to take off on what my predecessor speakers have spoken, and I believe it's exciting times for our country. It's not the same as 3 years back or 4 years back. You have to. Why I say that is we have a think tank. It's a very interesting think tank located in Delhi, and Vivek and the panelists in the first session alluded that Niti Aayog. When we talked about GST example. There was so much of, this will happen, that will happen. But today, GST is a reality. You're looking the numbers when the finance ministry speak about the indirect tax collection is phenomenal growth in that. There's a network, there's a backbone which has been built into that. If you look at the policy document of Niti Aayog 4 years back, in fact, they said that one of the methodologies to increase GDP of this country is towards healthcare. It has never happened before. And towards that, the lead ministry of the Government of India, which is taking this thing forward, is the Ministry of Commerce. Because Ministry of Commerce is responsible for increasing commercial transaction for the country. Under the Ministry of Commerce, you have an entity called SEPC, the Service Export Promotion Council of India. And these two entities are leading from GOA point of view, and they're putting big bucks. Since the past 3 years, every year the GOI has been spending 9 crore rupees. And they've created an entity called Advantage Healthcare India, which in very simple terms is a summit. It's an international summit which brings in 500 delegates across key target destination, and this will happen year after year to imprint upon the rest of the world that India is happening. The problem, like my speaker said, is that things were happening but in a very fragmented manner. It was individual hospitals, maybe a single hospital or a chain of hospitals which on their own efforts trying to project that come to this country for, but it might work, but that's not sustainable. Now, when you look at Joy, very nicely talked about Singapore model. Now, what exactly is the Singapore model? Singapore is a dot in the world map, just a dot. But the enterprise of Singapore is vision, the power of, I also like to talk about Dubai on the same bread. Dubai is just sand. Abu Dhabi has oil for 100 years. Dubai had oil only for 10 years. But the previous Sheikh Rashid Al Maktoum, had the power of vision that in 10 years, how do I leverage my oil wealth to create capital assets, which long term will convert this economy into a service-based economy. And that's what you have done. The mirage of Dubai, it's literally a miracle. A lot of similarities between Singapore and Dubai. Of course, in health sector, I would say Singapore is 2 decades ahead of rest of the reason is again vision. So they said that our greatest asset is human resources in terms of highly competent workforce. The doctors in Singapore, for your information, can just walk through into the UK systems. You don't have to write the GMC exam. You can, as Singaporean medical graduate, can enter into UK and you can go through higher education. Almost 90% of Singaporean doctors are UK trained. So that amount of credibility in terms of human resources is already built in. Same I would speak for nurses and paramedical staff. Infrastructure, as we all know, Singapore has got world class. But the most interesting part, the government hospitals in Singapore are Joint Commission accredited. Can you imagine that? A city-state which went 2 decades ahead and said that I want my public hospitals to be Joint Commission accredited. And they were, in fact, the front runners, and the private sector actually piggybacked into the vision of the public sector entities. The last point is what Joy just alluded, that when I ran a hospital in Dubai in 2002, I built a hospital in Dubai. I was quite surprised one day that there was this delegation from Singapore, because I didn't have an appointment for any Singaporean to come and meet me. So there's a delegation from Singapore to come and meet you in 2002. I was surprised when I went them and I realized that there are a couple of government officials, a couple of them are from the private hospital, but they all have the same visiting card which says Sing Health. I was so curious and wondering, and they said that we have come for the first time, we're just introducing ourselves. And then I called up my colleagues in other hospitals in Dubai, and the same delegation has gone and visited everyone. 6 months after that, in those days, the most luxurious hotel in Dubai, what we call as Burj Al Arab. It's like a sailboat, the most luxurious. And you have a helipad, facing out to the sea. Most expensive hotel you can imagine. They have sent invitation to who's who of Dubai to come for a, like a interaction, get together in 6 months' time. Now this I'm talking about 2002. You know what I'm trying to tell you? Prior to 2002, the government funds for overseas patients from Dubai, either from the Emirate of Dubai or Abu Dhabi, all used to go to Cleveland, Johns Hopkins, Mayo Clinic, all to the United States. Past the intervention of Sing Health in 2002, traffic started going to Singapore. So that's power of vision, but it's the power of, when you talk about strategy, it's not just one aspect. You have to get the building blocks together. Now coming to Vivek's question, that what are the challenges of our country? We are just fragmented. We never had a vision. We never thought that medical value travel is an employment, is actually a game changer for employment. Talk about Kerala, my home state. We are all talking about the burden of minimum wages. I have been talking since 4 years. I've been talking to all and sundry that this may happen. I didn't predict the minimum burden of minimum wages, but I said that if you want to bring in technology, if you want to bring in high-end infrastructure, if you want to continuously cross-subsidize your domestic population, the only solution for this state is to attract more of medical value travels. See, I live in the city of Kochi. I'm excited that I have hospitals like Lakeshore, I have hospitals like Amrita, we have medical trusts, we have Rajagiri Hospital, we have Lissi Hospital, Lourdes Hospital. We have 7 to 8 large, high-quality institutions in this city of Kochi, where I know that as a common citizen who lives here, you can pick and choose where you want to go. Forget these private hospitals. Our district hospital, the Ernakulam General Hospital, is an NABH accredited facility, my friends. So that builds credibility for us as a destination. Look at our airport, India's first greenfield airport in a PPP mode. First one in our whole country is in Kerala. Now when you land, you come into T3, which is a totally different terminal. All of you landed today or yesterday in the domestic terminal. In 2-3 months' time, you will come into a totally new terminal. Our old international terminal will be a new domestic terminal. It's a private-public enterprise model which is taking place. But from a policy point of view, what is exciting is both Niti Aayog and the Government of India has realized the bottlenecks. Now, this is specifically what are the challenges facing India. We have some absurdities. Absurdity of India is that if you come as a tourist to our country, the cost of your visa is much cheaper than your medical visa, the M visa. Medical visa is much more expensive. I want to go to Bangkok, it's free, online, ready. They will even give you a visa on the airport, whatever is it. It's not the same out here. You look at our key markets, like recently I was in Nigeria, and it's so sad. You go to the Indian embassy, you go to Abuja. The Indian embassy has got 2 rooms full of Nigerian passports. Actually so. Waiting list of 6 months for a Nigerian to come to our country. What happened? What is the issue? You speak to Mr. Reddy, His Excellency, our ambassador. He says that I'm helpless because we have real, genuine national security concerns. It's not only in Nigeria, Bangladesh, the biggest source of medical value travelers to our country. I mean, all of us in Kerala know that in Kerala we have 2.5 million Bengalis, Assamese working out here. The first language in Kerala is not Malayalam. It has to be Hindi or Bengali. We all know that. I mean, it's a fact. Joy, nothing. But it's just a fact. Now, you know, just few days back we were happy that ICMR discovered the source of the Nipah virus. Now it's recognized it's a fruit bat. But I always wondered that what the hell is the Nipah virus and the bat doing in Perumbavoor, in Kozhikode? Why is it there? If you look at the origin, the epidemiology of that, I always thought that it's something to do with the migrant traffic coming out here. It's unusual to have a Nipah virus outbreak out there. But coming back from a policy point of view, right things are happening, both at the central level. We had issues like I'm the national co-chair with FICCI for medical value. My struggle was that you're paying tax, and I told this to the government officials. Your 8 crore rupees belongs to all of us in India. It's taxpayers' money. There is no way of having the Advantage Healthcare Summit only in Delhi year after year because, hey, India is not Delhi. Why are you not allowing the rest of India to have posting rights? So they agreed with that. Principal Secretary Commerce Rita Teotia, she wrote to all the principal secretaries across states. And the first state to put the hands up to say that we will do was a state of cut. I tried my best to convince Kerala that please at least try and post this. You don't have to spend any money. All money spent by government, but nobody listened to me.
Harish, can I just ask you, just interrupt you for a moment? So, another very interesting. So, he said that infrastructure is probably one of the key areas why people are not bothering to come. You're saying that it's probably the bureaucracy which is coming in the way. So, the question is,
Vision.
Yeah, the question is that do you think these 5 hospitals you named in Kochi, do you think they are ready to accept, the rich who come here? And I'm saying that I'm not the cheapest, I'm the best. Do you think we are ready?
No, it is not as you're trying to make the complex problem so simple. So you asked about the state of Kerala. I would say,
how much of say Aster or I have Rajgiri here, I think all of them are there, Lakeshore is also here. How much of the percentage of top line is from MVT?
well, let me again answer. You're always asking trick questions. So
I'm getting roundabout answers, so I want that.
I can't give you direct answers, but I'll give you percentages.
Just a percentage.
Percentages. See, we have worked together since almost 2013 when that was not the first, but in which I participated was in Kochi, the Kerala Health Summit hosted by both by CIA and senior leadership team, the clinical leadership team. I would give a lot of regards to Dr. Philip Augustine, who was one of the pioneers to host the KHD summit since many years. But the traffic pattern, answering your question, has significantly grown towards Kerala. Why I am saying that?
All over the country data?
Yeah, I can give you one example of Oman, Sultanate of Oman. I know because
I'm asking that whether other parts of India, you get more liberty in Kerala.
Let me check. No, I'm not saying that. I'm saying that from the abysmal numbers in terms of percentages, pan-India versus traffic in Kerala, in the past 3 years we have seen a big upslide. Not just Omanis. Like when I told you 2.5 million Bengali migrant laborers in Kerala, you always wondered why are Bengali patients going to Dr. Chandy's hospital, previous hospital, to Vellore, but they're not coming. Vellore is not that far away from Kerala, but you have Malayalis going from here to Vellore. So it's a change in perception. The good thing is that by de facto, a lot of efforts by KHT and other players, we have actually started leveraging infrastructural advantage. See, the greatest thing about Singapore and why I'm saying that Kerala will be a success model is Singapore went into medical value travel because Singapore was already a hotspot tourism destination. Any part of the world which has got great infrastructure and brand recall value for tourism. Kerala is God's own country. We have to thank Amitabh Khan for that. We have to thank the government of the day in late 1980s to convert nothing into something. It's also a miracle of leveraging this state and our ecology into God's own country. So the top of the mind recall for ecology is already there. We're very strong in Ayurveda. Our heritage actually is in Ayurveda wellness tourism. That's also a heritage. To make the jump from ecology, God's own country to strong base in Ayurveda to modern medicine, it is not difficult for us. It's just a little bit of push, and I have no doubts in the next 2-3 years, Kerala will be one of the top players for medical value travel for our country.
Okay. Let me just now come to Benosh. Benosh, you have heard they are all running hospitals, right?
Yeah.
You are not a provider,
Absolutely.
like me.
Yeah.
And you probably know this subject very well. So you've heard all of them. What do you have to say? And one question for you is that, this MVT travel to Kerala,
Yeah.
especially Kerala, is it NRI Indians or is it, foreign nationals?
It's foreign nationals.
Foreign
See, I have been working in a company called Medigo. Medigo is a Germany-based company, Berlin-based, and we are associated with hospitals all across the world. And with them, I've been going to various Middle Eastern countries. So if you go in a cab in Oman, okay, and you get parley with the cab driver and ask him about if he has heard about hospitals in Kerala, they can tell you the names of most of the hospitals, most of the major ones.
So Harish has not replied that, he did that diplomatically.
No, so what he said,
Skirted that. Let me just come in. So how much is the, incremental in percentage medical value travel that you have seen? Forget about hospitals, just about,
it's increasing, definitely.
is there a percentage growth?
It's 15 to 20%.
15 to per
Definitely.
annum basis.
Definitely, it's if you go to all these Middle Eastern countries, they recognize the Kerala hospitals, and many of their relatives, people have talked to, they come here.
Only Middle East, or you think there are now?
Middle East in Africa. In Africa, it's not all that much, but in Middle East, the response, the recognition is very high.
And what is pulling them to Kerala?
Many factors.
Can you name some?
Yeah, one is that good number of Malayali doctors in the Middle East. Okay,
Nurses.
so nurses. So all these people,
So there is a automatic marketing system.
there's a relationship happening between. So that way, that particular market is already open. And secondly, this is easier. It's something like they can relate because they already have worked with a lot of Malayali. So that's also another factor.
So currently they are coming here, as Joy said, from a cost benefit perspective or from a qualitative perspective.
It's lack of facilities perspective one, and secondly, increased trust in.
Lack of facility in Middle East, there would be facility wise, I don't think they would be
Now
behind
it
us.
should be so different. For the past 5 years, so many hospitals have come up in, especially in UAE. So that is not a major factor by which people are
Oman,
coming. As you said, actually, like Lakeshore, Aster, all there's advantages like they have their own units. I actually work for Lakeshore BPS group in Dubai as well as here. So patients, once you see, and if they have any medical surgical procedure to be done, they would be happy to come here because there is something like a continued care in the same unit. Maybe if it is the same doctor, they will be much more happier. And in that segment, support service is also there. If it is the same kind of group, I think Aster also will have that kind of an advantage, as you said, some kind of a familiarity with the center. Same logo, same center, you are telling that you can have the same treatment done in this place. That may be a little more of an advantage for
I
them.
wanted to add something that this year is historic for Kerala for medical value travel, that finally after 3 years, our society is finally registered. That's a great news. We are actually the first Indian state to have a registered society called the Kerala Medical Value Travel Society, which is chaired by the Government of Kerala official. Like the Ministry of Commerce, what I told you in SCPC in Delhi, in Kerala it's led by KSIDC, the Kerala State Industrial Development Corporation. The good thing is that, like what the Government of India is doing in terms of spending money on road shows, promoting the brand India, the Kerala Medical Value Travel Society is almost on the pattern of Kerala Tourism Mart, KTM. So the Government of Kerala is going to invest money to promote Kerala overall as a medical value travel destination. So it's going to add up a huge, better fill-up because it was fragmented before, now it is coherent.
Right. Can I just come back to you? What are the kind of procedures for which patients are coming here in Kerala?
I don't think there's a specific. It's not procedure.
Like what he said, bariatric surgery,
Yeah.
organ transplant, cataract operations, knee replacement surgery. Is there anything in particular, or is it everything?
Particular. They just there's something wrong and they need a surgery. Just come. It's not
Actually, from
Okay.
this CUSAT, there was a study some 5 years before. They've actually categorized like for which it is coming. Mainly it was for cardiac treatment. Patients were coming, especially from this Gulf countries. They are coming for cardiac treatment, something like minimally invasive surgery segment, those kind of infertility treatment, dental treatment which is not covered. So those were the areas for which patients were more keen of traveling and coming this side. That's what I was telling. If we can offer some procedures which takes only few days of their hospital stay, like we do almost everything like a laparoscopic procedures. Just 2 days last time, one patient from one. Third day, they wanted to get discharged a little early. I said, what the hurry, anyway, you are going only after 4 days. No, they have booked for Munnar. So they can travel, enjoy the place and go back in a week. Just because we have done that procedure in a keyhole manner. So
it's leisure come healthcare.
Leisure come health is possible and their stay is also reduced. If you are doing
So I think Goa also does that in terms of cataract, dental, cosmetic.
Open surgeries means they are held up in the hospital for a week, then they are not, we also don't allow them to travel also. So if that kind of a focus is there on a procedure which can be just finished in 1 or 2 days of hospitalization, they have time and means permission to travel around, see and go, then they don't mind that means whatever extra cost is added also for travel, because they are actually coming, typically that words match, like tourism is happening, medical treatment is happening. Those
Can I
two
just,
things-
pick
more
on-
specialties I want to just add,
Yeah.
what has not been touched upon. 3 years back I knew that Sultanate of Oman, from the government side, they signed up with the hospital in Pune for the spine surgeries, and they negotiated for an annual 250 spine surgeries in that hospital. And they told this is going to be the amount what we'll be paying from the government. The other one, probably again we missed out, which comes in a big way in Maharashtra, is this cosmetic surgery. So these are the two other areas where good inflow is there in Maharashtra.
Okay. Let me just put it to the audience and Vijay, if you are there, is Rajgiri also looking, getting more numbers of medical value tourism? They are?
They have the best location next to the international airport.
Okay.
That's an advantage, but mostly we are getting GCC countries, especially Oman.
GCC and Oman. So Oman seems to be the place to have maybe a next office, maybe to promote Kerala tourism. Somebody to ask something.
Coming from the policy side of.
So can you also identify yourself so that?
My name is Balju Jacob. I come currently from Kraft Hospital.
Kraft Hospital.
And I worked as a policy advisor or the policy role in the British High Commission. All of us that know me as that.
Can you take the mic, please?
So, basically I want to just add on to what Dr. Harish has said. See, the policy level intervention in terms of healthcare and education, both. I'm comparing them. ACPC has done some initial thoughts, and the delegation to different places like Indonesia and other places are good activities which is done by ACPC. But what compared to the Western world, Germany, UK, US, what is lacking from the government side or the diplomatic side? I call it because the diplomatic side where I'm home. The diplomatic side is there is no multiplier activities done to promote the destination or the country.
So can you name some of the multiplier activities that you think could be done?
One is that healthcare, typical specialty healthcare association going to, like Cardiac Association of India, going to destinations which have more cardiac problems and promoting what actually we do better than others. Okay. One is that. Second is that we are choosing only, we are not identifying publicly funded market and privately funded market. There are two strategies. One is publicly funded market.
We just mentioned that that spine probably might.
That is a publicly funded. I worked in that particular country for around 4 to 5 years. That country had limitation of infrastructure, so there are a lot of publicly funded tourism. It's not tourism, actually publicly funded referral to countries which can accommodate the patient. It goes to Germany, UK as well as to India.
So now you have a question or you are?
No, I just have to tell Dr. Harish is already involved into this particular thing. I just want to give a suggestion.
Dr. Sandy, have you experienced some medical travel, because Tiruvalla is way off from Cochin Airport? Have you ever tasted that blood as yet? No. Okay, all right. So before I come to his question, I would just like you that I would want this to wound up with 1 or 2 suggestions to the government of India, the government of Kerala, or that you think can encourage medical value travel. So let me just come back to, so we can think about that. Yeah.
My name is Dr. Anwar. I'm representing Punarnava Ayurveda Hospital.
Ayurveda hospital.
Yeah.
Okay.
So Kerala has.
So are you experiencing a medical value travel in Ayurvedic hospital?
Yeah, definitely.
Is that so? Okay.
Yeah, we have 5 locations in Cochin. We are focusing more on medical.
What percentage of your patients are?
65% of occupancy from medical value travel.
Wow.
Yeah.
65%.
65%. Yeah. We have 265 bed strength in Cochin,
So where are you going to see Aster Ayurveda?
including NABH accredited hospital. What I am trying to point out is Kerala has the capacity to become the total healthcare destination. We have the state-of-the-art modern hospitals, step-down care,
You think that this infrastructure will support that?
Definitely.
Okay, all right. I
Step
like
down
that
care,
confidence. I
we
like
have-
that word, total healthcare.
Rehabilitation, Ayurveda, plus of course God's own treatment at God's own country.
Yeah, with God's own food.
Definitely.
Yeah, Malabar.
But still we are lacking a collective promotion, and we are just like crabs in many areas. Crabs in a pot which is pulling down the crab which is going up.
I never tell them no when they invite me, for this conference, because food is, excellent. Yeah,
So I just wanted to try point out the total healthcare destination.
I like that. Yeah. So we'll start the reverse way. Benosh, if you have some 1 or 2 quick suggestions, then
One of the areas that has not really been addressed is that what is it that Kerala has, which no other state in India possibly doesn't have. It's the younger population, high-end facilities, great medical doctors and paramedical staff. Now, if you were to look at Europe, Europe is aging very fast. Okay. Now, the average age in EU is around 42, and in Germany it's around 46. 6% of the Germans are above 80, and that particular that particular group is going to grow very fast. Something like the population of Germany is coming down, and the number of people in the old age are increasing.
the point is attract geriatric.
Geriatric. See, for example, Germany sent across around 20,000 patients, old age people, to Thailand, Philippines, Czech Republic, and Slovakia.
So geriatric.
Geriatric.
What
Geriatric is the area that we got to get into, because we have
Any other suggestion?
geriatric is the way to go.
Is the way to go. Harish?
I think specifically for the state of Kerala, our number one challenge right now is waste management. That in our neighborhood, our greatest competitor, Sri Lanka, Colombo specifically. While we say and we rightfully claim that we are God's own country, this is a ticking time bomb, the waste management issue. If we don't tackle that in a sensible, sensitive manner, this entire opportunity will just disappear. A mosquito does not know the boundary. That's the point I want to make. The second aspect is that
So infrastructure should be improved.
infrastructure has to be improved, especially in waste management in those areas. The second aspect is that all of us in healthcare, we have to learn from the success of KTM, the travel mart industry, that it is natural for a Malayali to be so cynical and skeptical, which is who we are. That's our DNA. But somehow, if we can rise above the cynicism and grab this thing, there is an opportunity to create real jobs. When my colleague talked about 74 different translators, I looked at as an opportunity that unfortunately, even if you talk about skill ability, language ability is mostly Arabic. But I am looking at a Malayali who can speak Czech, who can speak German, who can speak French, who can speak Thai, who can speak Chinese. If we can increase that tribe, that is a huge opportunity to bring more traffic to this state.
Okay.
So I'll talk about the national level as a part of CII. We are working on the policy development. Today, as he was talking about the policy for medical tourism, making it effective in terms of practice is lacking. So probably if you want to make it a preferred medical tourism destination, you have to have that in place. And second, being a provider, I think I want to suggest all the providers who are in this space, we need to be more transparent, we need to be even more open, and we should not be perceived that, as because we have got a foreign patient, we are trying to do something different with them than what we do in a regular case. So that kind of perception is still there in the countries when the patient come from other, other countries, they still think that I should not be fleeced, I should not be charged more. So that you have to give them the confidence.
Okay, fair enough.
Yeah.
Doctor?
Regarding what you are suggesting, actually, how to get across to people that we are good. One way what we can do is, like, there are a lot of speciality doctoral conferences which are happening. If those conferences are projected to other parts of the world, that itself will give them an idea that something good, very quality work is happening in this part of the world, and their believability on those doctors who are performing, because we have done that to a good extent. Even this month we are doing an international conference by which those doctors who are coming to attend, or even if it is transmitted to another area, they get more of confidence that these doctors are good, this particular specialty is far developed in this part of the world, and they will definitely send their patients with confidence to our medical professionals, and that will definitely increase on a very ethical and very comfortable way.
Okay. So any one question I can allow if one has to ask? Okay, all right. So I think, let me just wrap this up. Some of the points which I have understood and I think make a lot of sense, and I will begin from your side, is that maybe focused marketing of certain procedures will help. Like bariatric, like cosmetic, like probably dentistry, I don't know, or other things. I think that makes a lot of sense. Joy said, and I quite like that again, that rather than saying I am the cheapest, I would rather say I am best in quality. You need to pay for quality. Forget about the price as the attraction which is there. Which also probably happens for internal medical tourism within the country. Is that also part of MVT?
Yeah.
Internal
Domestic.
Domestic. Okay. All right. So Harish, as always, has been very eloquent in terms of saying that there has been a lot which has been done by the government, and it's very good to know that that is there. And of course, there is a basic need to improve the infrastructure. So that is one of my problem things in mind always, is that whether we are ready for the high value medical tourism, so otherwise we are currently getting maybe the rich of the poor and poor of the rich countries, who are still targeting us. They are not probably coming to us because we give quality health care. And as Benosh said, that probably marketing and the geriatric thing, I think you might also go to Japan for getting those patients, and they have the highest number of geriatric population. So on that note, I would thank the entire panel. Big round of applause.